Well, we're here with Dr. Melnick, a dentist in Laurel, Maryland. Hi, Dr. Melnick.
How you doing, Helmut?
Not bad. Not bad. Dr. Melnick, tell us about your dental practice a little bit. Give us an overview, because I know you guys do, lots of things. Some of them are, unusual and definitely slightly different than some other dental offices, despite the fact that, of course, you do fix teeth like everyone else does. Tell us a little bit of, what your practice is all about, will you?
Sure. Both Dr. Miles and I are hospital-trained dentists, which means that we have additional training over and above dental school. We also do a lot of continuing education, and it's reflected in a lot of the high technology that we have invested in our practice. In addition to doing conventional dental treatment like fillings and crowns and the like, we also do a number of expanded type of things that have moved us into a more broader view of our patients. So we work with a lot of medical doctors in some of the things that we do. For example, we do sedation dentistry. There's a large percentage of patients that have been avoiding going for regular dental care, and we may get into it, but it has enormous consequences not only on their dental health, but on their systemic health. We also do TMJ, or jaw treatment, where things like a misaligned bite can cause a variety of symptoms, things like recurrent headaches, jaw pain, ear pain, loss of feeling in the fingers. We also work with some of the local sleep dentists, the sleep doctors, patients that have obstructive sleep apnea who don't get a good night's sleep. It can have tremendous strain on the body and can severely shorten their lifespan. We work with the sleep doctors in our community, so we don't just do your conventional dental care. Certainly we do that, but we also do a lot of medically oriented treatment.
Wonderful, because as we will probably find out, it is actually quite amazing and not necessarily always paid enough attention to how much the oral health infects the rest of the body. After all, the teeth are not detached from the body. The only time they're detached is if you put in a denture, and we know that is definitely second rate from having fully detached teeth. And some of the things you mentioned, from headaches to tingling in the fingers to maybe neck tensions and all that type of stuff. But you also do what's considered, let's say you do the periodontal disease and surgery, I suppose. You do the implants, I guess. Are you doing orthodontic work, Dr. Melnick?
No, we don't do orthodontics, but we pretty much do the full range of everything else.
Okay, all right. And nevertheless, moms and dads can come with their children, offer that much with themselves, and you'll be well qualified to say, look, orthodontic work is the best for you, and you should start it, even though then they might start it somewhere else, not in your office, right?
Well, we work with some of the local orthodontists, so we know what the appropriate referral would be for patients. Right.
Well, definitely, it's a great thing to hear about what you're doing. Let's go into some more details of what different illnesses and different dental problem actually present. Thanks a lot, Dr. Melnick.